Hello children, today let us discuss about the STDs. STD stands for sexually transmitted diseases. Sexually transmitted diseases, the name itself indicates the cause, the mode of transmission. That is, these are the diseases which are transmitted through the sexual intercourse. These are the diseases which are transmitted through the sexual intercourse. The other names for the STDs are venereal diseases, which are also called as VD. Venereal diseases, which is named after the name of the Greek god Venus. Venus, Greek god name, which means love of God. And other name is the reproductive tract infections. So as it involves mainly the reproductive tract, so it is also called as reproductive tract infection, that is RTI. See, these STDs are very common. 85% of the STDs are found among the age group of 15 to 30 youngsters. And in these youngsters, the STDs are found more. And it is very important. The prevention of the STDs are very important for the maintenance of the good health in the society. So for this we have to know the causes and the preventive measures of the STDs. So STDs, the common causes for the STDs which is asked for 2 marks in the annual exam are that the unhygienic blood transfusion, unhygienic handling also you can say, or unhygienic blood transfusion. So always the blood must be checked for the diseases and the infections, etc. Of course blood group we will check, but for some we have to check the diseases also, the presence of diseases. For that also we have to check. That is, the unhygienic blood transfusion is the first reason. And the next, sharing of injection needles and the surgical instruments. So this is also one important cause for the STDs. See, the injections which are, the needles which are used for the injections for one person should not be used for the other person. Use of disposable syringes are the best. In case if disposable syringes are not available, one must sterilize it at high temperature. So that is very important. And sterilization for surgical instrument is also one of the preventive measures. And blades which are used for the shaving, especially in the males, should not be shared by the others. And next, from infected mother to the fetus. From the infected mother to the fetus, the diseases will get transmitted. Through the reproductive tract, gonorrhea is transmitted, and through the placenta, syphilis is transmitted. So next, generally the STDs are asymptomatic. Sometimes they will fool the person. It will appear and get vanished. They disappear, making the person, it will make the person to think that they got cured. There may be some allergy like that, but that also causes the STD. And also a polygamous sexual practice or sex with the unknown person. These are the causes for the STD. Now preventive measures for STD are monogamous sexual practice, or the avoid sex with the unknown person, and then avoid sharing, all this no you have to say. Avoid sharing injection needles, razors and surgical instruments. And then use of sterilized instruments, we have, always the surgical instruments after the use must be sterilized. And then awareness about the mode of transmission, awareness about the mode of transmission and prevention, we have to be aware. Now till now what I told, just today we are discussing about the STDs. What do you mean by STDs? They are the sexually transmitted diseases, which are also called the venereal disease or the reproductive tract infection. They are called venereal disease after the name of the Greek god Venus, a god of love. So these STDs are very prevalent in the youngsters, especially between the age group of 15 to 30. And you know that this is the this age group is very important as they are very resourceful. That group has got the very resourceful mind, young and energetic, and keeping good health of all, of course all age group is very important, but good health of these age group is very important. For that we have to prevent the STDs in the society to keep the reproductive health in a good condition in the society. Usually we will be not knowing whether the person is suffering with the STDs or not, because the initial symptoms of the STDs are asymptomatic. Sometimes if the symptoms appear also, they will get cured or they will disappear by themselves, making the person fool that they are some kind of allergy. That is also one reason that we will be not knowing STDs till they reach the advanced stage. The main symptoms of the STDs are the itching near genital area and the inflammation near the pelvic region and unusual discharge from the genital area. So these are the common symptoms. So when a person will be suffering with these diseases, these symptoms, they have to go to the doctor. That is the best way. And now we have to know the causes for the STDs just to avoid the STDs. Like the important cause is sharing the injections needles. Sharing the injection needles, usually in rural area, the injection which is given to one child is like that only 5 to 6 children the physician will give. So that must be avoided. In case of non-availability of disposable syringes, one must sterilize for half an hour the needles at 60 degrees Celsius and then use. So that is the best way. And we should not share the shaving blades, and sometimes the drug abusers also will share the needles. So this must be avoided. So just you have to know the mode of transmission. Mode of transmission also you have to know. And let me just say the in particular causes. So unhygienic blood transfusion and use of injection needles, surgical instruments and razors, and from infected mother to the child. And as they are asymptomatic, we will be not coming to know that suffering with the STDs, and also polygamous sexual practice in particular I told. So usually preventive measures we have to know just to avoid the contract of STD. One must avoid sexual practice with an unknown person, and better to practice a monogamous sexual practice. And we have to avoid the sharing of needles, razors and injections. And in the clinics or during surgery, the sterilized surgical instruments must be used, and one must be aware about the mode of transmission and prevention. So this will help a lot, and we have already discussed that the sex education has been introduced at the school level itself. So in the school and college level, the children will be knowing how the sexual diseases will get transmitted and what are the different methods of prevention. And in the preventive measures, one handling of body tissues also will come. Careful handling of body tissues, body fluids, let me write. One must be very careful when they will be coming in contact with the body fluid of a person, because in the body fluid, through the body fluid also the STDs will get transmitted. So this information is about the STD, causes of STD and the prevention of STDs. Now let us know what all the common STDs which are prevalent in the youngsters. Now let us see some of the examples of STDs. Now let us see some of the examples of STDs which I wrote on the board. Chlamydiasis, Trichomoniasis, genital herpes, genital warts, Gonorrhea, Syphilis, Hepatitis B and AIDS. Now let us say these symptoms just you have to know for the need. You have to remember the disease names. So among these diseases, genital herpes, hepatitis B and AIDS. These are non-curable diseases. So prevention is better than the cure. It is a saying and one must follow this. I told that initially if through the symptoms, if STDs are identified by a physician, one can get cured. Usually in the society, if the person is suffering with the STD, openly they will not share that with others. So it is a compulsory. It is a compulsory that the one must inform about the sexual partner so that the risk of contraction is avoided. Then also the people will hide the STDs. I told almost many of the STDs are curable if initially we will go to the physician, except AIDS, genital herpes and hepatitis B. These three are non-curable. So it is better to know the preventive measures and follow the preventive methods. Now let us discuss one by one. Causative agent, of course, mode of transmission we have discussed. Some of the important symptoms by which we will be coming to know that the individual is suffering with so and so disease. First here I wrote chlamydiasis. Chlamydiasis, it is a STD. It is a STD which is caused by a bacteria called Chlamydia trichomatis. It is caused by a bacteria called Chlamydia trichomatis, and usually STDs are seen in till now. Maximum reasons are multiple sexual practice, multiple sex partners. So that is the reason. And initially chlamydiasis is asymptomatic. We will be not coming to know that one has a chlamydiasis, but symptoms appear after 1 to 3 weeks of infection. Usually this may be the incubation period. What is incubation period? It is the time period between the infection and appearance of the symptoms. So here in the chlamydiasis, the symptoms appear only after 1 to 3 weeks of infection. And here the abnormal discharge from the genital organ and swelling of the genital organ is seen. Abnormal discharge from the genital organ and swelling of the genitalia. And then burning sensation during urination. During urination, the person will suffer with the burning sensation, and in the lower abdomen, discomfort will be there. That is discomfort in the lower abdomen. So these are the symptoms of chlamydiasis. With what you have to remember, the causative agent. What is the causative agent for the chlamydiasis? It is the bacteria which is called Chlamydia trichomatis. Chlamydia trichomatis. What are the important symptoms? Unusual discharge from the genital organs and also a discomfort in the lower abdomen and burning sensation during the urination. This you have to remember. Now second one is the trichomoniasis. Trichomoniasis, it is a protozoan disease which is caused by the flagellated protozoa. It is also caused by multiple sex partners. So here the important symptoms are inflammation of vagina in case of females, and in the case of males it is urethra. So inflammation in genital organ, you can say in the female it is vagina, in the male it is urethra, and painful urination. Here during urination the individual will suffer with the pain, and then yellow vaginal discharge with the offensive odor. So usually yellow discharge will be there from the genital organs in the male and the female, and that discharge will smell. And then a pelvic pain will be there. So these are the symptoms of trichomoniasis. What is trichomoniasis? It is a STD. It is a sexually transmitted disease which is caused by a protozoa, especially flagellated protozoan, and it is caused by the multiple sexual practice. So what is the important symptom? In this disease, the person will be suffering with the inflammation of reproductive organs. Reproductive organs in the sense vagina in the case of female, and in the case of male it is the urethra. And during urination, pain is seen, that is painful urination is seen, and yellow discharge from the genital organs which is having offensive odor. That is about the trichomoniasis. Now third one we are discussing is the genital warts. Genital wart, it is caused by a virus. It is a STD which is caused by a virus by name human papilloma virus, HPV. That is human papilloma virus is the causative agent, and it is also caused by the multiple sexual practice. And the important symptoms are appearance of warts around the anus and genital area. The warts are the hard red lump. Hard lump like a ball, it will appear on the body. Sometimes initially they appear around the genital organ and anus, and slowly they invade. They may spread to the vagina also. Sometimes they may appear around, on the body. So that is about the genital warts. Wart. Now next, the person with a history of genital warts may suffer with certain cancers like vaginal cancer, anal cancer, cervical cancer, and penile cancer. So this is about the genital wart. What do you mean by genital warts? It is a type of sexually transmitted disease, and it is transmitted by a virus called human papilloma virus, and it is caused main reason is the multiple sexual practice. What are the important symptoms? Warts around the genital organ. What are warts? They are the hard small lumps. So they appear initially around the genital organs, then it may enter in the female in the vagina and near the anus. Slowly it may spread to the body parts. On the different body parts we will see the warts. So this is about the genital warts. Now we have learned about the three diseases. What are they? Chlamydiasis, Trichomoniasis, and genital warts. In all these we have, of course, the causative agents are different. One, bacteria, protozoa, and virus. What is the important cause? It is the multiple sexual practice. It is a multiple sexual practice. So one must avoid that. Now let us go through the different diseases. Now the next disease is the genital herpes. Genital herpes, it is caused by herpes simplex virus. Herpes simplex virus. In these two strains are there, that is HSV1, HSV2. We can remember herpes simplex virus. So it is also caused by multiple sexual practice. The symptoms include the feeling of unwell. We feel that we are not feeling well, and tiredness, headache. So the first symptom, the feeling of unwell, tiredness, and headache, and tingling. Tingling feeling will be there at the lower back, at the genital area, and also legs. And fluid-filled blisters will appear near the genital organ, anus, and the thigh region. These blisters will burst within 1 or 2 days, and these blisters are very painful as they move along the nerves. So these are the symptoms of gonorrhea. This is genital herpes. What is genital herpes? It is a sexually transmitted disease. Genital herpes is a sexually transmitted disease, and it is caused by herpes simplex virus. It is caused by herpes simplex virus. What are the symptoms? A feeling of unwell, tiredness, and the headache, and tingling at the lower back, genital organ, and the legs. And blisters will appear around the genital area, and the blisters will burst usually within 1 or 2 days. And these blisters are really very painful, it seems, because they move along the nerve, and you know that nerve is the sensory cell of our body. Now this is about the genital herpes. The next one is the gonorrhea. Gonorrhea, it is caused by a bacteria called Nosema gonorrhea. It is a gonococcal bacterium. It is caused by Nosema gonorrhea, and here mainly it infects the urinogenital tract. It infects the urinogenital tract, and it includes itching and burning sensation around the genital area. Itching and burning sensation around the genital area, and yellow discharge will be there from the genital organs. Yellow fluid will get discharged from the genital organs, and frequent urination with burning sensation. For the urination, person will go again and again, but with a burning sensation. And if this gonorrhea is untreated, it may lead to infertility and arthritis. So this is about the gonorrhea. What is gonorrhea? It is a sexually transmitted disease and is transmitted by a gonococcal bacterium called Nosema gonorrhoeae, and it infects the urinogenital tract. It infects the urinogenital tract. There is a yellow discharge from the genital organs. Yellow discharge from the genital organ, and urination with a burning sensation. Frequently the person will go for the urination. And here, if it is untreated, it may lead to arthritis and infertility. Now let us go to the next disorder. Now we will go through the next STD, that is the syphilis. Syphilis, it is a sexually transmitted diseases. The symptoms of syphilis appears under different stages like primary, secondary and tertiary. Syphilis is caused by Trichomoniasis pallidum bacteria. Syphilis is caused by Trichomoniasis pallidum bacteria. The primary symptoms includes the appearance of painless ulcers around the oral and genital organs, and these ulcers are called cancre. So these cancre appear and they themselves will become disappeared. So it will fool the patient that nothing had happened, just the small bowels appeared and they vanished. So that is about the primary symptom. And secondary symptom which appear after 2 to 3 months. So here body lesions, the red patches will appear on the body, and also a generalized lymph node enlargement. So this is the secondary symptom. And in the tertiary symptom, usually tertiary symptom appear after 5 years. Till that time, these bacteria will invade the important organs of the body. With important organs are also called as vital organs like heart, respiratory organs, kidney, etc. They invade and start destroying them. So it leads to the generalized disability of an individual, and later it leads to death if care is not taken. So that is about the syphilis. What is syphilis? It is a sexually transmitted disease. It is a sexually transmitted disease caused by Trichomoniasis pallidum bacteria. It is caused by Trichomoniasis pallidum bacteria, and symptoms appear under stages like primary, secondary and tertiary. What is the primary symptom? What are the primary symptom? Appearance of cancre around oral and genital organs. What are cancre? They are the painless ulcers. They are the painless ulcers. They appear and disappear. So no one will bother about this as they are painless also. Now the secondary symptom, it usually occur after 2 months. So here on the body we will see the lesions. Red rashes we will see on the body, and the generalized lymph node enlargement is seen in the secondary symptom. And during the tertiary symptom, which appears usually after the 5 years of infection, just think over this. After the 5 years of syphilis infection, the tertiary symptom appear. Till the time what will happen? These Trichomoniasis pallidum bacteria will invade the important organs of the body, and those bacteria will start destroying them, which leads to the generalized disability of the body. Body slowly loses the function. As the important organs will get affected, it may then lead to the death. That is about the syphilis. And the next is the hepatitis B. Hepatitis B is also called as serum hepatitis. It is also called as serum hepatitis, and it is caused by hepatitis virus. It is caused by hepatitis B virus. So the symptoms are just like a flu. Symptoms are just like a flu. So here the joint pain, sore throat, nasal discharge, loss of appetite. The person will not feel like having the food, and nausea, feels like vomiting, and also tiredness, fatigue. So these are the common symptoms which also appear in other diseases like a flu. So then these these symptoms later follows the jaundice, as mainly here the liver will get affected, and if not treated in later stages, the liver cells which get damaged, the liver cells will get damaged and leads to the cirrhosis, which is also called as liver cirrhosis. What is hepatitis? It is also studied under the sexually transmitted diseases, as it is transmitted through the blood as well as through the sexual intercourse. What is the causative agent here? It is the hepatitis B virus. What are all the symptoms? The generalized flu-like symptom you will see. You will see pain in the joint. You will see the nasal discharge, sore throat, and you will see the nausea, vomiting you will see, and then the tiredness, and which in later stage leads to jaundice and then destroys the liver cells. Destruction of liver cells is nothing but cirrhosis. So this is about the hepatitis B. Now let us see the AIDS. Now let us know the AIDS. AIDS, it is also a sexually transmitted diseases which is non-curable, and the expansion of the AIDS is acquired immunodeficiency syndrome. It is a acquired immunodeficiency syndrome. It is called syndrome as it includes many disease symptoms. So that is about the AIDS, and it is caused by HIV. The causative agent for the AIDS is HIV, that is human immunodeficiency virus. And here initially it is asymptomatic. And then all the immune related symptoms will appear. Like the fever, weight loss, loss of appetite, skin rashes, and enlargement of the nodes. All these are generalized symptoms. So whenever we will be suffering with some of the diseases, these will occur naturally. So that is about the initial symptoms. And later on, the body will become susceptible for all the simple diseases which are not threatening to the life. Like even the common cold, fever, all these diseases, the body will become guest for all the diseases. The diseases, when they will come to a person who is suffering with the HIV virus, it will not get cured. So it will become home for diseases, and later it leads to the death. That is about the AIDS. And then we have to know about the non-curable diseases, non-curable STDs. Non-curable sexually transmitted diseases are 3, like hepatitis B, AIDS, and genital herpes. Hepatitis B, AIDS, and genital herpes are the non-curable diseases. So what are the diagnostic tests for sexually transmitted diseases? Some of the diagnostic tests let us discuss. The first one is culture and microscopic examination of pathogens by using specific strains. What we have to do is we have to culture the pathogens as they are microscopic. After culturing the pathogens, we have to test it by using specific strain. So by this method, some of the diseases are tested like Trichomoniasis and vaginal candidiasis. It is a fungal disease, fungal STD. And next is the antibody detection. The presence of antibodies against a particular antigen which causes the STDs. So the presence of antibodies in the blood can help in detecting certain STDs like syphilis, genital warts and the genital herpes. And then the screening test like ELISA and Western blot technique. ELISA, it stands for enzyme linked immunosorbent assay. Uh, what is the expansion of the ELISA? It is enzyme linked immunosorbent assay, and these are used mainly to test the AIDS. So these are the diagnostic techniques which commonly are used to find out the STDs after following the common clinical symptoms of STD. What did we study? AIDS. AIDS, what is AIDS? It is a sexually transmitted disease, and AIDS stands for acquired immunodeficiency syndrome, and this we will read in detail in coming period in health and diseases. So here it is caused by HIV, that is human immunodeficiency virus. What are the symptoms? Initially we will see generalized symptoms of not feeling well, like the enlargement of lymph nodes we will see, fever we will see, and weight loss, skin rashes, etc. Later, the immune system will become susceptible to the many diseases, and some of the non-curable STDs also I told you, that is Hepatitis B, AIDS and genital herpes, which are non-curable. So prevention is better. Now diagnostic test, in the diagnostic 3 I told, that is culture and microscopic examination of pathogen by using specific staining technique, and the next one is the antibody detection in the blood, and next is the screening test. So these are the diagnostic tests. So today we have completed the STDs. Tomorrow we will see the ART, that is assisted reproductive technologies.